My name is Hastings Agboragbor. Today I'm going to be delivering my speech about healthcare reform. I'm going to start with the introduction and definition of healthcare reform. Healthcare reform is a governmental health policy that was enacted into law to improve the quality and cost of healthcare delivery in the United States. For decades, healthcare reform has been a challenging and most discussed topic by the United States politicians. Healthcare costs remain high and seen as for a lot of U.S. citizens. These individuals include the senior citizens, the low income, and the disability. Today in the United States, life expectancy remains high as people age. Healthcare needs stay in constant demand. So introducing healthcare reform, which defines the need of the poor, old, and the disabled, will better the solution to the recent healthcare reform. The closest to the universal healthcare reform, as millions of Americans dream, was the Affordable Care Act, commonly known as the Obamacare, which was enacted into law in 2010. This information was gotten from healthcare.gov. According to Statista, with the Affordable Care Act being upheld, the number of uninsured Americans is estimated to decline by 33 million from 2012 to 2022, as projected by the Congressional Budget Office. The number of uninsured population would be at 27 million Americans as opposed to current 60 million Americans, also from Statista. Obamacare aspiration to transform healthcare delivery was a big dream to Americans, but the economic and business sector and major health industry that gains the most profits were a challenge to Obamacare to achieve its full successes. But however, Affordable Care Act still managed to achieve tremendous successes, and a few failures though followed in between. One of the greatest achievements of affordable care was that it slows the rise of healthcare costs. In March of 2010, Affordable Care Act became law. All components of healthcare sector was affected. The legislation include the public coverage, new subsidies for coverage, and health insurance exchange were mandated to lower the cost of consumers. This decision was made to increase healthcare coverage, access, and reduce cost. Unfortunately, the value may not be reduced for every individual. Those who did not qualify for subsidy may end up shopping for high-cost insurance. This information was also gotten from Frederick et al. 2012. The mandate of pre-existing condition to be accepted by insurance company reduced the stress of having healthcare coverage that may accept specific conditions, especially to the old patients. Many Americans have one or more diseases or illnesses to worry about. Before the introduction of the Affordable Care Act, many insurance companies deny healthcare coverage to the patients that has pre-existing illnesses. Obamacare intervened and mandated all insurance companies, including private insurance, to accept patients with pre-existing conditions. Unfortunately, Many patients that were denied coverage in the past, their diseases became chronic, and many end up in emergency rooms, some in intensive care. This increased coverage raised overall healthcare costs in the short term. This information was also gotten from healthcare.org. The introduction of a new policy for younger adult under 26 to stay on their parents' health care plan granted a big release for individuals who faces hard time maintaining a job. When the Affordable Care Act was enacted into law, the 2020 goal emphasized on expanding insurance coverage to a higher proportion of individuals and reduce the percentage of those who are unable to obtain coverage. So, introducing dependent younger adult to stay on parents' coverage works well for 2020 goal. Unfortunately, the potential impact on lack of accessibility to care may put younger adults in vulnerable situations that could cause care to be delayed or avoided. Lack of availability may also lead younger adults to seek attention to charitable clinics designed to serve individuals without health coverage, or enable a younger adult to pay higher copay. Each of these is possible repercussion among the youth. This was also gotten from healthcare.org. Conclusively, healthcare reform, unlike other countries, the main objective is to improve the quality of life, reduce costs, provide quality of care, and increase accessibility to care. Either one of these objectives has been a big challenge in the United States to satisfy all these classes of individuals that live in this country to obtain the required coverage. Also, to credit the evolution that took place in American healthcare system, as healthcare reform will continue to undergo improvement, hold on values to humanity, so there will be healthcare needs as services. Thanks to the American icons who have changed the face of healthcare and make it possible to improve life expectancy among our older parents and disabled individuals, including the poor. It is certain everyone must die, but how old do you want to get? Healthcare reform plays a big part on healthcare. Thanks to the people that transformed the face of healthcare in America. Thanks to the opportunity given to me by my professor. And thanks for the video. Bye.